eClinicalWorks recently visited Spectrum Family Medicine, a 5-provider private practice founded in 2001, situated in the Washington, D.C. suburb of Rockland, Maryland. To discuss the positive impact eClinicalWorks' comprehensive electronic health record solution has had on treating patients. Also discussed was the increased efficiencies and reduced number of days in AR achieved through eClinicalWorks' RCM services, performing all of the necessary functions to submit and follow up with claims, all within the EHR. eClinicalWorks spoke with Sally Belcher, family practitioner and co-founder, Denise Maness, practice manager, Dr. Carolyn Baier O'Connor, family physician, president and co-founder, Betsy Swan, nurse practitioner and co-founder, and Lisa, front office staff, about their successful implementation of eClinicalWorks.
We've had this office open for about 12 years now, and we just switched over to ECW 2 years ago. So actually it's been about 2.5 years since we transitioned.
It's so nice to have all the information at your fingertips right in the patient room. I love pulling up patient information online and sharing it with the patient immediately. If they have a question about magnesium supplements, I'll pull up my reference and give them a handout, print out a handout immediately.
The entire structure and the process of checking in a patient, and from the very beginning, from when they walked in the door till the very end, is very different than what it is now, now that we're electronic.
I think the other benefit is that we reconcile the medications every visit, which is very helpful. And we get the patients in the habit of reconciling their meds, and I just think there's a patient safety that can't be beat.
I think it's a lot easier than having to pull a chart. I mean, the patient needs calls, they need something, we can, pull it up and give them their answers right away. So it makes our lives a lot easier.
It makes our visits a lot quicker. We do see more patients than we used to, and also our billings have been much more effective than they used to be.
The reason that we switched was we were pretty much dissatisfied with our previous billing company by the time that we were getting ready to switch to eClinicalWorks.
Having it through eClinicalWorks has made things so much more efficient. I think that it has made things easier for my front office staff because now when a patient asks you for questions about their account, it's just simply a matter of a few clicks and they have the information at their fingertips.
I don't think we saw collections dip. I mean, it was a continuous flow of income throughout. We didn't have any, it was seamless.
We get very good reports, and the collections are very quick. I think we have a very short number of days in AR. Now,
on average, our days in AR are approximately 22 days, which I think is incredible. Previously, with our former billing company and when we were on a paper chart, our days in AR were in the low 30s. So I think that's a huge, significant difference. My assigned account manager, having that relationship, that rapport with that individual is important. And I actually have weekly conference calls with him. And so I think that that's important because I think that if you want to run a smart practice, if you want to run an efficient practice, you need to have that open dialogue with your account manager that works on your account and your individual practice on a daily basis. And I think that that's key and crucial, is to have that constant open communication.
Spectrum Family Medicine and eClinicalWorks, improving healthcare together.